Redwood Newsmakers is being brought to you by your local U.S. Cellular stores.
We're on the campus of Hospice of Humboldt in Eureka with Karen Ayers, nurse practitioner and clinical director of palliative care. Hi, Karen.
Hi.
For those of us who may not know, can you tell us the difference between hospice care and home-based palliative care?
Absolutely. Hospice care is provided for people who have finished going through their disease or illness-directed treatment because it's not working any longer, and they're close to the end of life. Palliative care, you could almost think of it as pre-hospice care. So before that time, when people are still going through treatment for whatever illness they have, helping them as an extra layer of support added on to everything else that's going on for them to help them reduce stress and treat symptoms.
Now, this is a team approach, isn't it?
Absolutely, team approach. Both hospice and palliative care are that way by definition. And so we have a nurse, a social worker, care coordinator on our palliative care team, and nurse practitioner myself.
Well, how does your team support older adults living with serious illnesses at home? For
older adults living at home, we can come in to the home, so they don't have to go out, which is often a good thing, particularly if somebody has trouble with mobility or they're bedbound. And we are in person. We can build relationships and rapport and really see with our own eyes, hear, sense what the needs are and work toward those.
Especially in an area like ours, which is very rural, what makes Hospice of Humboldt's care so important?
Well, hospice has been around for a long time, since 1979. They have been watching the needs of the community as far as this serious illness goes, and have recently rolled out this palliative care program. We are 3 years old. And so I think they have this big commitment to our community. Very important in a rural area where we're under-resourced in many ways. And also many rural areas don't have this hospice agency like we do.
Here's a question. What should local families know if they're caring for their aging mom or dad or any family member? What should people know if they need help?
If they need help, they should know that they don't need a referral to
is that
us. Right? Yes, they can just call our number. I'd be happy to talk to you. If for some reason our program is not right, we do have some criteria. We know many resources that we can offer and help you with some connections there. It is difficult to care for people as they get older. There's a lot to do and a lot of stress that goes with that, just not knowing. You know, most of the time we say, we haven't been through this before. This is the first time. So just like raising a child at the end of our life too, we haven't done it before, and so we need some help. Yeah.
Karen Ayers, nurse practitioner and clinical director of palliative care here at Hospice of Humboldt. Karen, thanks for talking with us about this important program for families.
Absolutely. Thank you for having me.
Yeah.